mask and glove and gown up for a heart attack victim.
Right.
And so they make the call
So
on the scene.
the guidance that they've gone out has been that if we come across a case where we think it may be a patient with Ebola, the cruisers, provided the patient is stable, they will immediately back out, and they're going to call an EMS supervisor, and they're going to call me. And I'm going to hear the history, and we're going to kind of go through and decide whether or not we think this is something they need to suit up for. And part of that is because we've already had the experience of cases, and, you know, we got a call one time, and I'll use a real case of a patient where the family thought that they may have Ebola, or the night bystanders thought they may have been infected with Ebola, because it was somebody who was from Africa. They had been in the United States for over a month, and they were on their way back to Africa. But they had been in the United States, but somehow in the hysteria, the fact that they were going to the airport to go to Africa, the logic got reversed, and they thought, oh my God. But when you sit down and you actually talk to them, said, no, they've been in the United States for well over a month. And in fact, their symptoms are more consistent with allergies. They don't even have a fever. And so there was some hysteria there, and so we were able to sort through it and got things settled down, and it was fine. But it's always going to be the hysteria on the part of the public. Hysteria, as you know, is contagious, and that can bleed over into other folks. And so we're able. So that's one of the reasons that we've got it. The plan set the way it is. Of course, I've always got my phone with me. So.
Mayor Pro Tem Gonzalez.
Thank you, Mayor. Thank you both for the presentation. I think that I feel very confident that we're well prepared to handle this, not only from our first responders, but also by having such great medical infrastructure. I think my concerns are more, and I'm not saying we're not doing a good job, but the emphasis, and maybe it's under you, Director Williams, for the outreach to the community. Because if we're preparing our response to handle when it does happen, then from a communication standpoint, I encourage you, Dr. Williams, to continue to do what you're doing and be out in the community, informing and educating people. I'm concerned that we have a large undocumented community here in Houston that sometimes is afraid to access medical care because of their status. And we've got to inform them as to, that they're going to be okay. This is a public health situation and we need to address it. Get the hysteria and the scare tactics out of it. It concerns me that here in the state we have a large uninsured population that generally doesn't have a medical home, seek care when appropriate. So I think that's important. And also making sure that we're informing Houstonians to be informed, to not fuel the hysteria or the false information out there, and also their own prejudice sometimes that many of us could have, because I think that can be troubling as well. We have a very international community, and there's many factors that go into play into this situation, and so we don't want to ostracize anyone, and we want to make sure that we're being respectful, especially those that may be of African descent. Again, we have a very international population, but I've heard people joking around where someone will cough and say, got Ebola? Got Ebola? Or one of the biggest threats right now are the Halloween Ebola costumes as well. I mean, so a lot of people, yes. And so, there's a lot of just, playfulness that goes with it. But at the end of the day, we just want people to be informed. And so from a communication standpoint, I think at the end of the day, I think they're going to trust their local government probably more than they're going to trust federal government at this point. There's just a general mistrust. So we're going to be out in the front lines, us as council members. They're more likely to see us than they are to see someone from the CDC. And so they need to be able to trust that we're voices that they can trust, that we're going to give them accurate information, that you all as leaders are out there in the communities working with our school districts. I'm curious how far of a region you're working collaboratively with. Is it only the 9-county region, 13-county region, or above? Because I guarantee if something happens in Sealy, our community is going into a panic as well. Because we're concerned about what's happening in Dallas, and obviously we send our sympathies, as the mayor stated, to them. But there are a lot of concerns, and like you said, it's troubling that somebody with the right gear in a medical environment can still contract this, and so we don't know the answers to that, and we don't know if and when it will happen, how that person will get infected. Will it be because they flew into Houston? Carrying it? Did they drive into Houston from another city and they were somewhere else? Will it be at their home because if somebody finally falls in, or will they show up at a hospital? So we don't know what that will be, but the more we could work with all communities, I think the better we will be. But I don't know if you have any comments about what region you're working with here locally or in this region?
Well, actually, our reach is much broader than regional. It's, and as I said, we are in constant contact with our counterparts at the state as well as CDC, which means that reaches nationally. I appreciate your emphasis on outreach, and one of the things that I think that we as an organization are very good at, and that is outreach. For the last 7 or 8 years, we have been going door to door in various communities, really promoting public health messages and providing interventions. As a matter of fact, we just concluded a door-to-door intervention called our assessment, intervention, and mobilization process in the Southwest, where we knocked on over 8,500 doors.
Thank you.
Councilmember Boykin.
Thank you, Mayor. Dr. Williams, thank you so much for that. You're absolutely correct. You guys knocked on my door. Thank you for that. And Dr. First I want to thank the media and thank both of you guys for one specific reason, that you guys at least bringing this to the attention of the citizens of the city of Houston, in particular the city of Houston employees. So media, thank you for not letting a negative spin get a hold to this. Dr. Peirce, Dr. Williams, thank you all for explaining it. I do want to make a couple of comments. You mentioned earlier about general acute care hospitals, and I think that's important that people understand that these hospitals, including St. Joseph, I think is the only one located downtown Houston, are following all CDC guidelines and regulations. They're in place in case something happens. I am concerned about the stigma of, and this has nothing to do with you guys, the stigma that, you know, when you start sniffling and you're from Africa, there's a chance that people are going to assume you have this disease. And I think that's unfair to our brothers and sisters that are here from Africa that can catch a cold just like we would normally catch a cold. So I think we need to be mindful of that and be careful than to just judge people. Tony Henshaw, one of the city of Houston's, he's from Nigeria, one of the city of Houston's most stellar employees, you know, come and visit with a council member. If he's sneezing, you know, we don't want people to start thinking that way. So let's be mindful of that. Director Williams, is there a way, or you may already be doing this because I know you run a proactive operation, is there a way you can send out an email or consider sending out an email to let the city of Houston employees know symptoms? For example, these are flu symptoms. This is what we would think would probably fall in line with Ebola, as my niece say, E. coli symptoms. It's Ebola. I'm just trying to share some light to say. But anyway, so people won't assume because you have a flu bug and you're from Africa, you have Ebola.
Councilmember, as I said earlier, actually, Dr. Peirce said, after today's briefing, a letter will go out to all city employees.
Thank you.
That letter has already been drafted and signed, and it will go out today.
And I want to again, thank you so much, Director Williams. I again want to commend you and your staff for that door-to-door canvas operation you guys have going, and it's been constant. And I just think the world of it. People looking forward to get your information now, so continue to do that. But again, I just want to let everybody know that my understanding that based on my research, that all hospitals are following the CDC guidelines and will be prepared in the event something like this happens. Dr. Peirce, again, thank you for your information. Dr. Williams, thank you again, and let's hope and pray that we don't have this penetrating our city. Thank you.
Councilmember Green.
Thank you, Mr. Mayor, and thank you for your presentation.